In terms of what we use our exosomes most commonly for right now, number one is going to be wound healing. So we saw a tremendous change. I think once our Mohs surgeons and those who are doing a lot of surgery understand the implication of these exosomes, not only are we seeing faster healing, but more importantly, we're seeing less wound contracture. And and also less edema. So for what I use it for on a regular basis, I still do blepharoplasties, but I don't do any Mohs anymore. So I use it immediately topically after we suture. I use it after multiple procedures that we do, whether we're using a combination lasers, even chemical peels. Why? I want the efficacy of that inflammatory response to come into play to make sure that we can optimize our results. The second thing that we're using it for is melasma and hyperpigmentation. Can we regulate what that pigmentary effect is going to be? Can we downregulate the melanocyte? Can we make sure that we decrease the inflammatory component? The third portion that we use it for is edema. So those patients who, after any type of procedure, they're more likely to swell, whether it's an IPL, whether it's a pulse dye laser, or any other device that we use, even hair removal. Can we put this on topically to decrease that inflammatory response or regulate the inflammatory response to make it more efficient? And then the most interesting thing that I see right now is hair growth. So we're in the middle of a trial right now. We're doing multiple verticals. We're putting everything together. We're using an external anti-inflammatory device, so that's an LED. It's got 3 different wavelengths. One is a red light, blue light, and an infrared light. And does it matter which one we use? What's the time that we need to utilize that? And then can we then do a mechanical effect, so whether it's general microneedling, so just mechanical microneedling, or a pulsed wave radiofrequency microneedling? There's only one out of 24 different manufacturers in the world right now that lets us do a pulse wave, because then we're not going to damage the actual hair follicle or the end hair itself. So we can use that as a mechanical portion, apply these exosomes on top, and then put the LED on. And we're seeing tremendous amounts of growth. My question that I pose to you as the user, you as the person who's the scientist behind this video, is this. What if we can do something that's even less invasive than microneedling or less invasive than radiofrequency microneedling? And that's what we're playing with right now. We're trialing a 1340 nanometer wavelength, no consumable laser to see, can we enhance those results? We're trying another one where we're using a 1927 thulium laser, and we're doing a third one, which is going to be a 2940, which you're like, erbium, yeah, it's been around for a long time. But the pulse is so quick that you barely have any downtime with this, and we're seeing, can we get better results? So the future for exosomes is huge. I'm curious to see what it's going to do internally if we ever get to that stage. I want to see what it's going to do for my joints, because no matter how old I get, I want to still stay and feel like I'm living in my 20s.